what we see typically around us in America is not how we should age or could age. It's a result of a whole set of dysfunctions in the body that are driving abnormal aging.
Hi, everybody. This is Dr. Bob Hariri at Piloting Health, and I am delighted, absolutely delighted, that I have with me today Dr. Mark Hyman, author of a whole host of remarkable books, including Young Forever, one of my favorites. And, Mark has just been not only a pioneer, but one of the best educators in the field of longevity and performance medicine that I've known of. And like I said before, I'm a tremendous fan, and I'm always thrilled to get a chance to talk to Mark, see him, and work with him. So, Mark, welcome aboard.
Well, thanks for having me, Bob.
So, Mark, you and I are both, it's funny, we're both the same vintage, probably arrived at our obsession with understanding the whole aging process and what we can do to address those things which limit us as we get older. But let's start right at the beginning. So you often refer to the way we age as kind of the gradual cumulative decline in quality of our health and our performance, increasing acute illnesses and chronic illnesses, and becoming less independent as a component of abnormal aging, which it seems to me that pretty normal aging has all of those problems as well. So can you elaborate in your mind, what's the difference between normal and abnormal aging?
Well, Bob, it's great to be on this podcast. It's an important topic. And I think that what we see typically around us in America is not how we should age or could age. It's a result of a whole set of dysfunctions in the body that are driving abnormal aging. And so when I went to the blue zones, I saw 95-year-old guys running up and down mountains. We don't see that in America, who are sharp as a tack, hanging out with their friends, having a ball, and living a very vibrant, connected life, not in a wheelchair or struggling to get up and move around. And we've come to sort of accept this way we age in America as normal. We accept that the last 20% of our life is going to be in poor health with medications and doctor visits and various chronic diseases. I mean, 6 out of 10 Americans have a chronic disease. 4 out of 10 have more than one. Over 80% of people over 65 have a chronic illness. It's, quote, normal, but it's actually not. It's actually a sign of underlying problems that we're now beginning to understand that explain all diseases of aging. So we're treating most of the diseases we see out there kind of like whack-a-mole. Let's treat heart disease, and let's get a medication for your blood pressure and your blood sugar and your cholesterol, and let's treat your kidney problem and your liver problem, and everything's separate. The problem is the body's one whole system, and that there are root dysfunctions that occur that lead to all these different problems. And so if you treat the root, we don't have to treat these diseases. And in fact, medicine's got it all wrong. It's all about the science of creating health we should be focused on, not about the science of treating disease. And that's exactly what you do with cellularity, is you are actually in the science of creating health and activating the body's own innate repair, longevity, rejuvenation, and repair systems. And that's what we have to learn how to do. And it's not that hard to turn on those longevity switches, to identify those ancient survival pathways that are embedded within us that have been kind of dormant because of what we do to them. We eat too much of the wrong food. We don't exercise. We have too much stress. We don't sleep. We're exposed to too much toxins. We have all kinds of stuff we do to our microbiome that makes it go wacky and create inflammation in our body. So by understanding actually how to optimize the sort of dials or to upgrade our biological software, we can literally not only prevent the disease of aging, not only actually slow down the process of biological aging, but literally reverse our biological age.
I love the way you approach this because, like me, and you're a practicing physician. I've been in industry for like 30 years, but when I was back in the operating room and so on, I agree with you. I saw the way medicine's practiced as kind of like a defeatist attitude. Like, hey,
Yeah.
you know what? we're gonna see patients at the worst moments of their lives in most cases, and it's trying to have a palliative approach to stuff. And it's funny. Your biological age is decades younger than your chronological age. So you've figured this out, man.
Mm.
You've come up with ways to understand the hallmarks of aging and how to address it.
Yeah.
So considering what you know about the field, and you've literally been one of the foremost leaders in telling people what the real problems are and how to address them.
Mm.
How do you address the hallmarks of aging that impact you?
Well, I think, one of the things we got wrong in medicine is we're very reductionist. We're focused on various organs and diseases rather than treating the system. So functional medicine is about treating the whole system and understanding that the body is a network. And so what's really exciting to me is that the world of longevity science is paralleling the world of functional medicine. And when longevity science have described these 9, 10, 13 hallmarks of aging, and we can go through what those are, they're basically describing these fundamental dysfunctions that arise, that underlie all disease. So you don't have to know the names of 155,000 diseases. You just have to understand these basic processes. For example, how nutrition affects us. That's one of the hallmarks of aging, deregulated nutrient sensing. We have to understand the process of inflammation in the body and what causes it and how to regulate that. Our microbiome, which is our gut, it's a core part of functional medicine. Our mitochondrial function, how we make energy and how that degrades over time and our mitochondria get damaged, so key to longevity. Our ability to regulate our gene expression, which is so key to functional medicine, understanding that we are not fixed with our genetic code. We can't change our genes, but we can change the expression of those genes. And this is the whole field of epigenetics and epigenetic reprogramming that is so exciting in longevity science. But we've been doing all this in functional medicine for a long time. So when you begin to understand that, okay, there's all these different processes to go wrong, like stem cell exhaustion and shortened telomeres and DNA damage and mitochondrial dysfunction and damaged proteins and altered cellular communication, inflammation, and microbiome changes, and so on and so forth, we actually can start to understand these as not just separate different things, but they're all related. And what's exciting to me, Bob, is that they're not all equal. So all these hallmarks are not equal. There's I think, a meta hallmark that is probably the most important. And this is the way we interact with our food, how our biology is interacting with our diet. And this term deregulated nutrient sensing, it's a mouthful, but basically, as I began to unpack this field, it was really clear there were these ancient embedded longevity switches or pathways in the body we have, 20,000 genes, however many we have. 3,000 of those genes are designed to activate survival mechanisms in our biology, right? Not deal with abundance, which we have too much of, like abundance of food and all this crap. We don't have to worry about that anymore. And we don't activate these ancient pathways. So these four switches, two of them detect an excess of nutrients, and two of them detect a scarcity of nutrients. And people have heard about these things. They just don't understand, like mTOR, or
Right.
maybe they've heard about insulin and insulin resistance. Well, those are the two pathways that are detecting too much of something. So if you have too much sugar and too much starch or too much protein all the time, your body is constantly turning on this growth mode. Well, that's not good if you keep growing your belly bigger or growing cancer cells or growing bad stuff in your body. You don't want to do that. So we want to have periods of pause in our intake of food to activate the proper longevity switches, to inhibit mTOR and to reduce insulin in the body. And that's key to longevity. And that's done through things like time restricted eating or intermittent fasting, or through, for example, exercise or various phytochemicals that regulate these pathways, such as, mTOR, for example, can be regulated by pomegranate or by berberine or curcumin or other amazing just natural plant compounds, broccoli extracts and various kinds of mushrooms. So we can use food, and we can use timing of food, and we can use phytochemicals to regulate those pathways. The other, and people have heard me say example of taking rapamycin. Rapamycin is a drug that helps to inhibit mTOR. Well, that's a good thing, but not all the time, because you want to build
Right.
muscle. Like, we've talked about earlier, muscle is the currency of longevity. If you don't have muscle, you become weak and frail. And it's not just because you can't move your body around, but your muscle is a metabolic organ. It's regulating your hormones and inflammation and so much of what's going on with your biology. And so the other two pathways in this sort of nutrient sensing system are sirtuins and AMPK. And AMPK and sirtuins detect low nutrient states, basically not enough food around. And then they get turned on. And when they get turned on, they reduce inflammation, they increase our antioxidant systems, they activate DNA repair, they activate mitochondrial formation, improve mitochondrial function, they turn on tumor suppressor genes. So it's really quite amazing what happens. And inhibit something called NF-kappa B, which is the master regulator of all inflammation in our body. So by regulating what we eat, when we eat, how we eat, the phytochemicals in our diet, we can learn to like fine tune these switches, almost like upgrading our biological software. And what's important to understand about these four pathways is they influence all the other ones. So when these ones are screwed up, you get more damage to proteins, you get more mitochondrial injury, you get more microbiome problems, you get more inflammation, you get more telomere shortening, more DNA damage, more bad epigenetic changes, and more stem cell exhaustion, and more zombie cells, and all the things that we see as part of the aging process are influenced by food. Now, these pathways are not only affected by food, right? They're affected by exercise. They're affected by hypoxia, by saunas, by cold plunges, by various phytochemicals and herbs and mushrooms. So it's quite amazing how we can start to understand these master regulators of longevity. And so rather than take, for example, metformin for regulating AMPK or insulin resistance, there's a lot of things that work a lot better, and it has to do with like our diet and exercise and other things. So it's kind of an exciting moment to really to sort of see these worlds of functional medicine and longevity science kind of overlapping and starting to tell the same story and saying, if we eradicated heart disease and cancer from the face of the planet, as you wrote in your book Life Force, we could maybe extend life by 5 to 7 years. But if we address the hallmarks of aging, we might get 30 or 40 more years of healthy life. That's a game changer. And so that's really what functional medicine is about, the science of creating health.
What I love about it, Mark, is that everything you say is hopeful. It's optimistic. I mean, it means that, we've figured some things out. We can begin to make some fine, mid-course corrections, the fine tuning you're talking about. And I agree with you. I mean, I've seen it personally. I remember the concept, the old tenets around nutrition, three square meals a day, snacks in between, and so on. The abundance of food meant that the quality of food could decline as long as you had a lot of it, and that clearly has completely changed behavior in society. But you're showing us, hey, you know what? Creating long duration where you pause use of your digestive system actually has tremendous benefits. And by the way, I found going to the intermittent fasting approach was really easy. It took about 2-3 days before I was happy with it, And man, having that extra hour and a half a day is really pretty good. So what you've educated me so much. I can't thank you enough for that. So, but you're also like me, very much focused that nutrition's part of the answer. Controlling that is important. But you, like me, recognize our mobility is equally important. Explain to me what you think about that.
Well, they go together, right? Because in order to maintain your function by in a musculoskeletal system, which is key to being able to do what you want. Like I want to go play tennis after this podcast. Yesterday I went mountain biking, up in the mountains. I want to, go helicopter skiing. I want to jump out of a plane. Like I gotta have my body working to do that, right? I almost jumped out of a plane over the pyramids, but we couldn't get it working when I was in Egypt last week. But I don't want to be limited, and so both food and exercise are the sort of two pillars of that you have to understand in order to activate these ancient pathways. So when it comes to exercise, you can get away with not exercising a ton when you're younger. When you're older, you just can't. Like I remember when I was younger, I would go for 3 months without exercising, and I could go run 5 miles, and it was like nothing. Now, I can't do that. So I know that I have to maintain my muscle mass, I have to maintain my cardiovascular fitness, and I have to be consistent about it. And it doesn't have to be a crazy amount of time. It can be 30 minutes, 3 or 4 times a week of strength, and the same for cardio. And that what that does is that activates, again, so many of these ancient embedded pathways. It improves mitochondrial function, improves insulin sensitivity, it improves your epigenetic programming. It helps with all the nutrient sensing pathways that we talked about. It's really the key. If you could put exercise in a pill, it would be the most powerful longevity drug on the planet. It works on every one of the hallmarks of aging. It works on almost all diseases that we can see that happen to us as we get older that are killing us: heart disease, cancer, diabetes, dementia, all of it. The four horsemen of the apocalypse of death and disease and aging. It fixes all of them. So I think exercise, unfortunately people get lazy and we don't have to do much in our society. We don't have to deal with too much stress. I mean, physical stresses.
Yeah.
And that's part of the problem. We've been coddled so much. I was in Egypt recently, and was seeing, like, how do they build these pyramids and how do they build these temples? And they had to use their bodies. They had to lift stuff. They had to move stuff, and I think we don't have to do that anymore. And that's really caused this rapid decline in our health. So I think I think I saw this video, it was on Instagram the other day. It was really cool. It was a woman probably in her mid 70s, and she was trying to learn how to do strength training, and she couldn't balance. She kept falling. She kept falling over. She couldn't lift this. She couldn't lift that. And they showed her as she kept working at it. She was doing stuff that I don't think I could do. Like, and she was this 75-year-old lady, and I work out all the time. All these really intense things that she was able to train her body to do, and you can do that at any age. Now, I want to just say one thing for people listening. It's really important. People get confused. They think, okay, I want to live a long time, so I have to induce autophagy, which is a self-cleaning process. I have to inhibit mTOR with fasting and rapamycin and all these wonderful things. And they say, in order to do that, you should probably be a vegan. Now, here's where the problem comes in. You, yes, need to inhibit those pathways of insulin signaling and mTOR regularly in order to activate self-cleaning, repair, and healing. But you also have to turn them on in order to turn on muscle protein synthesis. Otherwise, you lose muscle. So it's not like a black and white thing. You just have to pick, turning them off. You have to pick turning them off and on in the right way at the right time. And the key to fasting is not just the fasting part, it's the refeeding part. And what people don't understand is it's the refeeding that causes so much of the benefits. And the key is, what are you refeeding with? Are you fasting and then having pancakes and maple syrup for breakfast? Or are you having a protein shake or a bunch of eggs and avocados and fat? So we actually need to activate muscle protein synthesis with the right amount of protein. And we need probably 30 to 40 grams. It depends on your size and so forth. But it's probably double what the RDA is, which is 0.8 grams per kilo. And we need high quality protein, which means the right amount of a particular amino acid called leucine, which is the rate limiting amino acid for building muscle. If you don't have 2.5 grams of leucine in a protein meal, you are not going to turn on the switch to turn on mTOR and actually turn on muscle protein synthesis. So you can be a vegan, but you're going to have to jack up your protein powders with amino acids and leucine. And so it's not as easy as you might imagine. So that's why you see a lot of people who are older who are vegan or vegetarian, they can be more frail and more thin and lose a lot of muscle. So it's really key to understand the exercise piece and how to actually use exercise with the right diet to actually build and maintain muscle.
What you're saying makes complete sense, and it's the preoccupation with one strategy that often leads people down the wrong pathway. I've seen a lot of folks. You remember back in the old days when the preoccupation with fat intake changed the way people made their dietary choices, and now we realize how important fat is to the diet. I worry about some of
Yeah.
these syndromes. There are even cognitive decline syndromes that are associated with
Yeah.
with, with minimalizing fat intake. But what's striking is that you're also suggesting that there's a cadence and a cycle that have to be created around
Yeah.
these approaches, right? So like you
Yeah.
said, fasting has an important role, but making certain that when you unfast, that you're putting the right elements into your body, and that actually creates the greatest benefits. So nutrition and exercise. What about mental state and stress and kind of the psychological environment you create for yourself and your family? How does that impact aging?
Well, huge. I mean, in the book you wrote with Tony Robbins and Peter Diamandis, Life Force, you talk a lot about the importance of mindset. And one of the things that I think, beyond food and exercise, which are foundational, and obviously sleep, is is our sense of purpose and meaning, our beliefs, our emotional state. This is such a key factor in longevity. And you look at, I mean, I was talking to a friend of mine the other day. I have I have my, grandma so and so, and she lived to be like 98 years old, and she was overweight, and she ate Oreo cookies, and she drank too much. But she had the most amazing collection of friends and community and family, and she was always engaged. And and when I went to the blue zones and I traveled to the blue zones to see what they did, there's no nursing homes. Like there's no loneliness. Loneliness is as bad as smoking 2 packs of cigarettes a day. It's worse than being overweight for your health. And in these countries where they live a long, long time, it's not because they have better genes, it's because they have a deep sense of meaning, purpose, and connection, and community and love. That is so powerful. And so getting your mind right, dealing with your social network is so important, and your beliefs also play a huge role. A lot of people don't realize that your thoughts are actually biological transducers. They transmit biological signals to every cell in your body. So your immune system, your microbiome, everything is listening to your thoughts. And so if you're running a negative program in there, your biology is responding to that. And if you're running a positive program, it's responding to that. I actually was very much connected to this guy named Bernie Siegel. He was a surgical oncologist guy. You don't know if you heard of him. He wrote a book called Love, Medicine,
Sure.
Miracles back in the 80s. He was a crazy guy with a bald head. And he was always talking about love and his patients. And he would tell these stories about how, they would take a cancer patient who was terminal cancer and say, we created this amazing new drug that's going to cure your cancer. They'd give it to the patient and the cancer would disappear. And then they would tell them 2 months later, well, we found out that didn't work, and their cancer would come back. That's because of the body's, pharmacy, internal pharmacy between the ears is the best pharmacy in the planet. And we can use that pharmacy for our benefit. And that's part of the key to longevity.
I can't help but when I listen to you, think about the impact this pandemic had on the health of the world in general, in large part because of the isolation, loneliness, the despair that was really a consequence of a lot of the public health measures that were implemented. I mean, I can tell you, I can see it in my kids, my 3 kids, two of whom were in college, one was in graduate school. The way we managed that, I think, was just so counterproductive. And I think the consequences are going to be long-lived, and we got to do something as we emerge from this, to never allow that to happen again. You know,
Absolutely. Yeah. No, absolutely.
and I love what you're saying about in the blue zones and in parts of the world where um, the human and societal interaction is the cornerstone of communities, right? Where,
Yeah.
like you said, they don't have nursing homes because the families and the friends take care of each other and so on.
Yeah.
So what do you say are the breakthroughs that are happening in this field that you're going to pay attention to and are going to be really central in your strategies going forward?
Well, I think it's really exciting is understanding a little bit more about this field of activating the body's own innate pathways for healing. And your work with cellularity, whether it's stem cells, exosomes, natural killer cells, is part of that. But also there's the whole field of hormesis, which I think we're beginning to understand stresses that actually activate our body's survival pathways. Because for most of the evolution of humans, we had very tough conditions we had to live in. We had extremes of temperature. We had abundance of food for some parts of the time and lack at other times. We had to use our bodies. We didn't have all the devices we have to make our lives, quote, easy now. But in a sense, that easiness is killing us. And so the signs of hormesis to me is really fasting. Obviously, fasting is a stress that doesn't kill you, that makes you stronger. Exercise, whether it's resistance or cardio training, um, cold therapy, heat therapy. Obviously, you need the right dose, right? If you're too long in a sauna, you'll die of heat stroke. If you're too long in a cold plunge, you'll die of hypothermia. So, but these stresses of temperature activate again some of these embedded longevity pathways that help to repair us and keep us young. Hyperbaric oxygen therapy, I think, is a very exciting therapy for killing zombie cells and lengthening telomeres and helping repair tissues. Plasmapheresis, I think, is a really exciting therapy that isn't even that expensive relative, for example, to stem cells, but that's shown to have huge promise in cleaning out the blood of some of these old proteins and inflammatory molecules that make us age faster. So there's a lot of cool stuff coming down the road. I think rapamycin is very exciting as a potential longevity therapy. Metformin, I'm a little bit more dubious about. I think we need to see what the results of this large trial called TAME trial is coming out, because there's some conflicting studies that show that it may benefit or may not benefit. A new one show that it may not benefit longevity. And one of the concerns I have about metformin, and a lot of people are taking it for longevity, is that it impairs your ability to benefit from exercise because it impairs mitochondrial function, which you don't want to
Right.
do as you age. So that's kind of a worry to me. But I think we're seeing a lot of really exciting things. I'm also really excited about empowering people with their own health data. I started a company called Function Health, which essentially is a lab testing company. It allows people to access over 106 biomarkers for $500. Normally would be $15,000 for the test. And then through AI and machine learning, give them a set of recommendations personally designed for them to optimize their health. Because I believe that 80% of what people need to do to stay healthy, to prevent and reverse disease, is stuff they don't need a doctor for. They can do it on their own. I've seen this over and over. It's the basic foundations of lifestyle and maybe a few supplements, but that'll take care of it for most people. And I want to empower people with that information.
I love that concept because, we talk about being the CEO of your own health. The truth of the matter
Hmm.
is, medicine is like going to the auto mechanic, right? We don't
Hmm.
know the nomenclature. Most of us, when we're very disarmed when we go into these alien environments.
Mm.
But your company is going to empower people, right? And it's going to force
Yeah.
them to understand, but not only understand, but to utilize that information, that data in making their choices. So I think it's absolutely fantastic. You mentioned something else too. You mentioned apheresis, kind of cleaning out the garbage
Yeah.
that circulates. So listen, man. Let's face it. You got to change the oil, right? So
Yeah.
our engines do not last if we don't clean out the garbage that occurs
Yeah.
in the oil and accumulates in the oil. So have you done any of the apheresis therapies?
Yes, interesting, Bob, that you asked me that. I done it a couple of times. The first time was just sort of as a just general rejuvenation therapy. I always say if you don't have a headache, an aspirin doesn't do much, right? You don't feel it. But I had COVID, and after I had COVID, I went to see my friend Matt Cook, who I think you're close with as well.
Sure.
And I was struggling, and I had a little bit of fatigue and brain fog and sort of post-COVID stuff. But worse, I had a terrible arthritis in my hand. My whole joint swelled up, and my hand was all swollen and painful. I couldn't close my hand. And I went and I did plasmapheresis with ozone. After he cleaned the blood out, he basically took out all the cells, cleaned and kept them separate, took the plasma out, which is the soup that the cells float around in, tossed it in the garbage, and then my body reconstituted the rest of my blood, put the cells back in, and also ozonated it to clean the blood as well. And within a few hours, it was gone. And the next day, I felt like $1,000,000. And I was like, holy crap. And I recommend it for people with long COVID, for people with autoimmune diseases, for people with chronic inflammatory problems. And it's a traditionally accepted therapy in medicine for a very limited set of indications, but it's actually quite safe and effective.
I got to tell you something. Matt's been a pioneer in introducing these approaches, and I agree with you. It's shocking how quickly the benefits of cleaning out the accumulated proteins and other garbage in our plasma, how fast you can see benefits. But you know what it says to me? It says that what we used to think was this this crazy concept of therapeutic bleeding, which was a hallmark of treatments back during the Renaissance
Right.
period,
Bloodletting.
hundreds bloodletting, right? The tools that they used to use, the razor blades they used to use to open up veins and bleed people. I think George Washington was bled when he had a chronic kind of pneumonia and so on and so forth. But the bottom line is that we have the ability today to clear up a lot of the accumulated things that ultimately degrade us, and it's circulating around in our blood that we're beginning to basically understand that every insult we have, whether it's an infectious disease, even a local injury, you're accumulating some of the byproducts of the cleanup that have to get out of the system. So we got a couple of minutes left. I'm again big fan of how you've educated folks to use the tools, but also the systems that are in place. So
Yeah.
there are a growing number of clinics and sort of executive kind of be the CEO of your own health systems that are out there. I think that's going to be a new wave in healthcare. This
Yeah.
proactive. Any thoughts about what if you were to tell like a 60-year-old individual who's had reasonably good health, who really aspires to live in a very productive life into their 90s and beyond, what would you say are the four things that are most important for them?
I think the first thing is really get your diet straight, and that means cut out starch and sugar for the most place. Alcohol should be like an occasional treat. Eat tons of phytochemically rich food, lots of colorful fruits and vegetables. Have the right amount of protein at the right time, and that's more than you think to build muscle. Do the time restricted eating. Don't eat 3 hours before bed. Just get your nutrition straight. It's not that hard. Second is get on exercise. Resistance training is way more important than people think for preventing frailty, for building and preserving muscle, and it's just non-negotiable. The third thing is really focus on building your community, your friends, your social network. That's what matters, and that is such an ingredient for health. And then obviously there's a few other things that people can do, whether it's things like hormesis therapies, hot and cold therapy, ozone therapy, cryotherapy, whether it's plasmapheresis, some of these fun things. And then there's a bunch of supplements that I think would be really important for people to take. My favorite is NMN, which activates sirtuins and helps many of these longevity pathways. Also, I like something called quercetin, and there's a company called Big Bold Health that makes something called H2B Rejuvenate. That's a whole class of bioflavonoids that comes from Himalayan tartary buckwheat, which is very rich in these phytochemicals. I think a cocktail of other things like curcumin, green tea, broccoli extract, also great. Vitamin D, obviously, the right kinds of fish oil, very important. So these are just basic foundational supplements. And then, I think if people really want to venture out, there's more exciting things they can try, like what you're doing, such as stem cells, exosomes, natural killer cells, plasmapheresis. So there's a lot of kind of fun stuff out there, but the basics are so easy for most people and accessible and don't cost anything. What you eat, when you eat, exercise, community friends, small collection of supplements, some simple hormesis practices of hot and cold therapy, you're going to get 80% of the way there.
Mark, I cannot thank you enough. I love listening to you. You know what you do is you create a sense of optimism. You identify the problems, but you give solutions that are very, very addressable. And listen, man, I'm gonna follow your lead. I can't thank you enough. Great to see you. Hope to see you in person soon. And
Yeah, I'm going to come visit your cellularity center in LA when I go next time, for sure.
I can't wait. I can't wait. Enjoy where you are. And when you decide you're going to jump out of an airplane, let me know, all right?
All right.
Take care,
Thanks,
Mark.
Bob.
Thank you so much. Thanks, everybody. This is Bob Hariri. This is Piloting Health. And you just heard from one of the world's experts, Dr. Mark Hyman, a great friend and a mentor. So, Mark, great to see you, man.
All right, buddy. Thank you so much.